Hi everyone, I'm Cassie Goodman, and today I'm here with Ashley for another interview on Paint Nevada Pink. And Ashley is a nursing student at Nevada State, as well as a young breast cancer survivor. Thank you for being here, Ashley.
Hi, Cassie. Thank you for having me.
Yeah. So the Paint Nevada Pink campaign is really trying to push annual screening mammograms starting at age 40. But I understand that you had a family history and went for genetic testing earlier than that age. Could you talk about that a little bit?
Yeah, my mom's side of the family has the BRCA2 gene mutation runs in our family. My mom had breast cancer and she passed away from that in 2012. But when I was 24 and pregnant with my son, I had my OBGYN test me for the BRCA and it came back positive.
So, with that mutation, it puts you at a higher risk for breast cancer. And based on that, what type of screening protocol did you and your physician decide on?
So I ended up just going in for a random doctor's appointment and talking with my nurse practitioner, who's like my general physician, talking about my medical history or my family history and the fact that I have the BRCA mutation. And she decided to have me go in for an MRI. Just being younger, that tends to be more effective than a mammogram in younger women. So I went and had that done, my first ever screening, and that's when they actually found that I had a couple of masses in my right breast. So first ever.
And how old were you when you went for that MRI?
I was 28 at the time.
Okay. All right. And as we mentioned, you are a breast cancer survivor. So tell me a little bit about how that early screening MRI affected your outcomes and your treatment plan.
I think that having kind of randomly caught it uh, so early, I ended up being diagnosed with stage 2A breast cancer, which was like the better side of stage 2, I guess you could say, where there was one positive lymph node removed when I had my surgery, and so that kind of automatically um, made them want to have me do chemo and radiation, um, but having caught it so early, I think my treatments were probably not as extensive as they would have been if it were farther along. So that and being young, I think, has been beneficial. My being young and being able to kind of handle those treatments, be a little bit better than somebody that might be older. Um, but for sure, I mean, if it would have, who knows how long it could have gone on until before we found it, if I didn't know about the the BRCA2 mutation and didn't get screened early. Like there's no telling how long it could have gone on before finding out about it. So
Yeah, because if you go off the guideline that we're really promoting, it's starting at age 40.
mhm.
But again, what's good is you realized you were at a higher risk. You had that testing to confirm you were at a higher risk, and you had that screening done at a much earlier age. And that's really what we want to encourage all of you to do who's watching. If you think you're at a higher risk for breast cancer, talk to your physician, have a formal risk assessment, discuss genetic counseling and genetic testing, decide on a plan because you may need to start mammograms and MRIs at an earlier age. So, really encouraging everybody to talk to their doctors, go in for a formal risk assessment, perhaps genetic counseling and testing, and really discuss if you need to begin mammograms and MRIs before age 40.
Absolutely.
Is there anything else you'd like to share with the viewers, Ashley?
I don't think so. I just want to say thank you for having me. I've become really passionate about, making sure that people know the risks, especially younger women. It's becoming more and more common for younger women to develop breast cancer, cancer in general, in kind of the world that we're living in today. So it's really important that the people, are on top of getting care and finding out what's going on with them, because it could definitely save your life. Breast cancer is 100% curable, especially the earlier you catch it. So it's really important for me to make sure that women my age, my peers, even younger women, whether they have a family history or not, are really on top of it. So it's really important.
So you're a great advocate for all of our viewers out there.
Thank you.
And everyone, continue to keep checking this Facebook page for more interviews and more information about the Paint Nevada Pink campaign. Thanks and have a great day.